The following questions have been developed to help ADRC staff to identify if dementia is a possible issue for a consumer or his or her family. Here are some questions you may want to ask a family member or other person who supports someone with possible dementia. Does he or she tell the same stories or ask the same questions over and over again? Have you noticed if he or she is more forgetful, such as forgetting important appointments, family occasions, or holidays? Has he or she lost interest in his or her usual activities, such as hobbies, reading, or social activities? Have you noticed any changes in his or her moods? For example, does he or she seem sad, irritable, or suspicious? Does the person have any problems finding the right words, such as when finishing a sentence or naming people or things? Have you noticed if the person's having difficulty with managing finances, such as balancing her checkbook? Do you have any concerns regarding safety, such as leaving the stove on, getting lost, driving safely, taking his medications correctly? Has he had difficulties finding his way around or been unable to recognize previously familiar locations? Now here are some questions you may want to ask a person calling on his or her own behalf. Are you having problems doing familiar tasks, for example, cooking, doing laundry, or shopping? Do you think you've become more forgetful? Are you having trouble finding the right words or names during conversation? Do you sometimes forget where you are or where you're going or what you're doing? Have you ever been told that you repeat questions or say the same things over again? Have you become lost when you're walking or driving? Have you noticed or has your family told you they've seen changes in your mood or personality? For example, have you experienced any sadness or irritability or frustration lately? Do you feel like you've been worrying more than usual lately? As you engage in these conversations with families or consumers, remember to pay special attention to the way people react to your questions. If a person is visibly frustrated or upset by a question, find another way to ask the question or move on to the next question. Your goal is to determine what information and resources will best suit each individual, but sometimes people are not willing to offer certain information. Sometimes people need more time to develop trust before discussing certain issues. They may not confide in you right away, but a person may contact you again when he or she is ready to offer more information. Sometimes people don't know the answer to particular questions. This can be extremely frustrating and cause a person to effectively shut down and refuse to answer any more questions. Sometimes admitting that they or a family member is experiencing challenges is very hard to do, and by answering the questions, they're admitting that there is a problem that needs to be addressed. Also remember that true person-centered care requires first and foremost knowing the person. So the more specific information you can find out about the person, his or her life story, habits, preferences, and available supports, the more accurately you'll be able to recommend resources that will help that person. Now let's talk about what you should do if a dementia diagnosis is involved, or if you suspect that dementia may be an issue. If you're speaking directly with the person experiencing memory loss, ask, what's the best way to share information with you? Would information in writing be helpful? Is there someone else who can help in decision making? What do people do to help you? To try and identify the kinds of tasks with which a person may require assistance. Who helps you? Or who do you live with? To identify potential sources of further help and information. And finally, do I have your permission to contact them? Contacting a family member or other care partner may open the door to the person receiving needed services or supports. If you're having trouble understanding the person, or you feel that you need to speak with someone else to clarify what the person is telling you, you can ask some of these questions. Is there someone there with you right now who could help me understand what you're telling me? Can you share your family member's name and number with me? And do I have your permission to call your family member about your concern? Ask if the changes have occurred fairly suddenly, over the course of a few days or weeks. If so, they should talk with their healthcare provider as soon as possible. These changes could be the result of medication side effects or interactions, a urinary tract infection, or a mini stroke. If a person with memory issues does not already have a diagnosis, recommend they schedule an appointment with their healthcare provider to have an assessment and explain the benefits of being assessed. Refer the person or his or her family to the ADRC website and help them navigate if possible. Remind them that they can type in a zip code to view local resources. Encourage the person to call back with any questions they have in the future. Always leave the door open for future interactions. And remember to track dementia in the ADRC call module or care tool to allow for further follow-up. In some cases, a person may already have a diagnosis of dementia, and a family member or other care partner will call the ADRC looking for information and assistance with the day-to-day aspects of caregiving. One common issue caregivers face is how to prevent and respond to behavioral expressions that can be challenging. Chances are you've already received inquiries from caregivers who have had questions about behaviors. As you respond to these questions, please think back to our discussion from Module 2 and remember that behaviors are the way people with dementia communicate their unmet needs. Remember that the actions and behaviors of a person with dementia are that person's way of communicating. And remember that every behavior is a form of communication and every behavior has meaning. You can help caregivers to realize that understanding and meeting the person's needs is the best way of responding to behavioral challenges that may come with most common causes of dementia, and that by doing so, they will also improve the person's quality of life, and probably their own too. When a caregiver contacts you seeking assistance about a particular behavior, there are several things you can do. First, ask some simple questions to try and determine what assistance the caregiver may need right away, as well as on an ongoing basis, in order to safely care for the person with dementia. Recommend resources that may be helpful, both for the person with dementia and for the caregiver. We'll talk more about specific questions to ask when a caregiver contacts you regarding a severe or emergency behavior-related issue. But for now, here are 2 resources you'll definitely want to have in your back pocket to share. First, the ADRC information on the website. Second, the Alzheimer's Association's 24-hour helpline,